Hi there, my name's Clipchamp. Just want to do a quick chat about a case that we finished, and this patient was treated with spark aligners. He came in initially because he didn't like the gap between his upper front teeth. He told me that I know people think the gap is cute, but I don't like it anymore. So I said to him, "So you want to close the gap and be sexy?" And he says, "Exactly, that's what I want to do." So we took him from the photo on the left from being cute to being sexy. So the gap is closed. We did some whitening, and he was really happy with the treatment. And it was done without using any fixed braces at all, using aligners. Now we'll go into a bit more detail into this case. So this is his start. So he's got the midline gap here, got a bit of crowding between the upper teeth, a bit of crowding in the lower teeth. He's got a baby tooth, retained baby tooth on the left side. This is the after. You can see we've widened the upper arch a bit of expansion, a bit of expansion in the lower, and the baby tooth is still there. So this is looking at the upper teeth from below. So you can see the arch shape is a bit more U-shaped, and also we've placed a bonded retainer. So there's a wire behind the upper front teeth, and this is called a fixed bonded retainer. Now, when you close gaps between upper front teeth, there's one way you can close a gap between the upper front teeth is by bringing the teeth back, provided the lower teeth allow you to do that. And in this case, that's how we close a gap. Close the gap by bringing the upper teeth back and widening the arch. So once the teeth are in the correct position, the gap is closed. What tends to happen is if you don't have a bonded retainer, then during the day the gap will open up a bit, and then you'd wear your removable retainer at night. In the morning, the gap will be closed, but during the day, the gap will open up again. Now, you can't wear a removable retainer for life during the day. So one of the ways of stopping this happening is I put in a fixed wire retainer, and this is called a bonded retainer. So this is fixed in, and it holds the gap closed during the day, and at night he still wears the removable retainer. One of the disadvantages of this bonded retainer is that you can't floss the teeth. You can't floss in between the teeth. And so what you have to use is something called superfloss, which threads underneath the wire and enables you to keep the teeth clean. And also you can use a water flosser. That's another alternative. His lower teeth, he had mild crowding, and that's all been aligned. The baby tooth is still there. When you're treating patients and they got retained baby teeth, you always warn that these baby teeth can become loose during brace treatment, and in this case it didn't, stayed firm, and he'd probably have the baby tooth for another long while. Here's the left view. You can see the baby tooth there. You can see the before, after. The teeth look much whiter. We did whitening as well, and they look straighter, and the patient was overjoyed with the results. And here's looking from the right side. So before, the after, had a bit of rotation on that tooth, and when we straightened it, we corrected the rotation and closed the space. So this was treated using spark aligners. Took about, including the whitening, took about 10 months. So actual brace treatment probably took about 7-8 months, and then the rest was whitening and then monitoring the retention as well. So hope you like this presentation, and the patient, he was overjoyed. I could have done a bit more tweaking with the braces. I could have corrected this a bit more, but the patient was happy with the result, and wanted to finish the aligner treatment as fast as possible. So there we have it.